So I'm Kamaria, use she, her pronouns, and I'm with the SERO Project. And we're a network organization that centers the leadership of people living with HIV, including our staff, our entire staff of 6. We're a small little family. Does this work to end HIV criminalization, mass incarceration, racism, social injustice by supporting the inclusive people living with HIV networks and state coalitions to improve all the things. I won't read the whole thing because I'm going to talk more about what this looks like in a moment. Next slide. And just a little bit about me. I am a woman living with HIV for over 20 years. I think it'll be 23 this fall. I like to tell people I was born with chronic optimism and Black girl magic. And I also am grounded in this work through my lived experience and the belief in the power of the people. Next slide. So I want to start us off by, as I talk about lived experience and connecting it to what Jada and Nathan have shared, when you're doing this work, the one thing that these two colleagues of mine, these great friends of mine, always model is MEPA, which is the meaningful involvement of people living with HIV. And that is the process of keeping us central to the creation and determination of policies, funding, services, research, and initiatives that affect us. So in all the work that Nathan and Jada have talked about, people living with HIV have been at the table to help ask the questions or share the information or amplify the strategies that come out from this movement work. Utilizing MEPA requires centering us as integral to the decision-making process in the HIV field. So that goes across anything, not just having us show up to receive services or offer feedback afterwards. Next slide. Some examples of leadership by people living with HIV is what I'm going to be sharing with you all. So from federal agency engagement to creating and moving state level policy, we are more than data points that you can create programs around. We are key to solutions needed to end HIV criminalization and other strategies that are implemented for us to get to an end of HIV. Our voices are needed from the onset, not as an afterthought. Next slide. One example of this is the U.S. People Living with HIV Caucus wrote the first ever policy agenda written by people living with HIV in a response to the National HIV/AIDS Strategy when it existed in a friendlier time. So that's one example of how our voices were amplified and how we were able to get into rooms to talk about issues from research to quality of life to immigration to housing, anything that impacts our lives. Next slide. Another example, and one of my favorites, is how people living with HIV move legislation. Pictured here is Tim Jackson from Illinois. And the thing that I love sharing is that in Illinois, they repealed their HIV law during COVID. Like they were meeting with legislators, they were mobilizing and talking to people and having meetings, even while it was really hard to navigate how to get in front of legislators and how to continue your strategy or pivot your strategy from a coalition standpoint. The thing that's really significant about folks like Tim and other states as well is the majority of them all attended the HIVisNotaCrime Training Academy, which is the only conference space that's hosted by people living with HIV. For people living with HIV, we rotated on conference campuses every year. Every other year, correct myself before Tammy, my co-director, comes and gets me. Every other year. So our next iteration of HINAC will be next summer. And we're currently in the RFP process to find locations. But they've all either hosted or attended the conference, met other people in their state to mobilize and build like a 30, 60, 90 plan, built a coalition, and then within X amount of years, were able to make some sort of significant change in their state. So the root source of MEPA does live at HIVisNotaCrime Training Academy. Next slide. And then another example that I'm kind of proud of is another form of MEPA is implementing things that give folks other talking points and other methods and pathways of how to navigate these conversations. So I think it was 2021 when Biden declared HIV criminalization as a concern and an issue from the White House administration. I then decided the idea that's been living in my head for a long time since I came into this work was that it was time for us to have an awareness day, because one of the problems I was being based in Florida, a problem I was coming into was contacting public health folks and getting them to support um, um, different strategy points around talking to legislators. And a lot of folks didn't want to risk their job and had to separate their job from the issue. So this awareness day gave them an opportunity to have talking points without saying, vote on this bill or don't vote on this bill. So the awareness day is on February 28th. It's that day was chosen to highlight the two populations of folks who are most impacted by the laws. So it sits between National Black HIV/AIDS Awareness Day, which was February 7th, and Women and Girls HIV Awareness Day, which is March 10th, also highlighting Black folks and women as targets of these harmful laws. Next slide. And so ways that folks can identify if they're utilizing MEPA in their organization and actions is by looking at, and sorry, that's a little cut off there, but looking at your leadership and representation in your organization or your programs. What positions do people living with HIV and marginalized communities hold where you're working? Are you utilizing intersectionality? Have you considered how stigma and racism and sexism and all the isms and forms of oppression are operating in your organizational practices, especially by people who are caught in the crosshairs of being vulnerable to HIV? And then lastly, well, it's not lastly, this is not an complete list, but also looking at your leadership and representation overall, and how are we, people living with HIV, providing input into your organizational program, your research studies, the development of your grant. Not just are we included in the narrative of the grant, but did we help you write the grant itself, or other service deliveries. Next slide. Ways you can help in identifying that, and while you're navigating this, is if you have opportunities from your expertise space to build strategies for any of the following bullet points here, just make sure you're including people living with HIV, not as a token, but asking them, are they interested? Do they even want to learn how to do the thing that's listed here if they've never had that experience, such as giving testimony at hearings, writing letters to the editor? I'm hosting a op-ed letter writing session next week to address the Florida ADAP crisis that's happening there. And other ways to connect, other ways you can help is connecting with state advocates and the people living with HIV, working on decrim efforts in already established coalitions, or in a space where you can start one to ensure that people living with HIV are always at the forefront. And there's ways to do this without them having to be visible. Like they can be an advocate without having to visibly disclose or say that they're living with HIV. And there's ways to do this without them having to be visible. Like they can be an advocate without having to visibly disclose or say that they're living with HIV. Next slide, I think is my last. Yes.